I was always interested in the brain and I wanted to do something in the brain, but to be honest, I started out as an engineer. I was in a PhD studying biomedical optics, and I had a couple classes where I had clinical interactions and I loved working with patients. I especially like doing procedures. And so it was actually pretty early on, even in my PhD, when I started looking at neuroendovascular surgery, which is treating lesions in the brain and spine with catheters and other devices. And the pace of clinical practice, especially in my particular specialty, is very fast. Patient comes in with an acute stroke. Within 30 minutes, they go from being paralyzed to being able to talk to us. It's dramatic, it's life-saving, and it's very fast-paced. So I love that aspect of it, that I get that immediate feedback of what I'm doing. I see two patient populations. I see patients who are coming in through the emergency room with an acute stroke, either bleeding in the brain or a blood clot in the brain. Those patients typically are in extremis, and I may meet them briefly before the operation, but in most cases they have to be whisked quickly to the operating room to do a life-saving procedure. That's probably about 10% of my practice. The other 90% come to me in the outpatient clinic to talk about something that was found oftentimes incidentally for workup of something else, either a brain aneurysm or a malformation. And so they come to me in that context to talk about how do we manage this new finding that unfortunately cropped up in their workup. I'm endovascular, which means that I treat everything through a catheter. I do everything through a small incision, either in the wrist or the groin, and we pass the catheter up through the blood vessels to the brain, where we can then use tiny devices to treat the abnormal blood vessels. The biggest thing is just making an impact on patients. Somebody who comes in unable to speak, can't walk, can't move one side of their body, and then we're able to immediately address the blood clot that's causing those symptoms that can be life-altering for them.